Thank you. Thank you, Marie. Right, good afternoon, everyone. Welcome to this decision day. Councillor Hiscock, I know you're making a deputation. Do you want to make it now, or do you want to wait till the relevant item?
I don't mind, whichever suits you better, Chair. I'm happy with either way.
Shall we wait till we're going to discuss the agenda item you're talking to?
That probably makes sense, thank you.
And that's agenda item
7, I think it was.
7. Yeah. Okay.
Okay. Thank you, Chair.
If I forget, just nudge me, won't you?
I will do. Thank you.
Thank you. Okay, so let's go to agenda item 1, which is the rapid discharge service and discharge to assess live-in care. And is Denise here?
It's actually Gail Kirby and Denise, I think, that will speak to this item. Thank you.
Right.
Denise, do you want to kick off?
Happy to. Good afternoon, everybody. I believe I'm just asked you to give a quick highlight, Tracy. So this is in relation to the rapid discharge service and live-in care discharge to assess service. So since the commencement of the pandemic in March 2020, Hampshire County Council have both commissioned and supported a number of home-based services for hospital discharge, home and bed-based D2A models. The services were commissioned by Hampshire County Council and set up by Hampshire County Council in collaboration with and on behalf of the NHS as part of the official COVID response, using hospital discharge funds. These services have proved very positive, supported a very high number of people to either stay out of hospital or to be discharged from hospital to a safe space in order for their full holistic, therapeutic and care act assessment to take place. Due to the ever-moving nature of the pandemic and the continuing concerns going into this winter, we have been requested by our CCG and health colleagues to continue the services around until the end of next March, so 31st of March 2020. And we are able to do that for both home-based services. So rapid discharge is a domiciliary service for people in their own home, live-in care short-term service for people in their own home with a live-in carer. So this supports individuals who are medically fit for discharge in a very timely way to be assessed in their own home. Recharge funding for these services is requested and has been agreed by all of our health partners round until the end of March. But the request to accept member is for a modification to 6 of our rapid discharge contracts and 4 of our live-in care contracts to be extended round until the end of March, which would be a full cost of 3.1 million. Are there any questions? This is the first time I've done this, so sorry.
Okay, thank you, Denise. Gail, do you want to add anything to that, or are you happy?
I think that's a good summary, Denise. I think just to say that these services are supporting around 250 people out of hospital each month, and with the continued pressures on hospitals, we expect that number might increase. So in that extension, we've also added some flexibility to be able to provide some additional hours and cover as we get into the sort of winter period.
Thank you. I must say, I would hope that we can continue it after next March and it just becomes business as usual in the future, because I think it's a great step forward in delivering care to people. But however, Councillor Withers, do you have anything?
No, I fully endorse what's been said and the recommendations. Executive member, I think, as you've said, it's been a welcomed service in society, and long may it reign, and it will only grow.
Yeah, thank you. And Councillor Briggs.
Thank you, Chairman. I also think it's a very good thing to have and hope it continues. How do the public people know that it's available?
So when an individual is admitted to hospital, part of the discharge team allocated to that hospital will work with the person one, as soon as they're medically fit to be discharged, to understand what the best option for them would be in order to be discharged. So the ward staff and any of our staff who are in the hospitals will walk through with that individual what is available and what might be best for them. I literally just stepped out of a meeting in relation to communication. We're just rewriting all of our leaflets and our public facing campaign in relation to these services, so it becomes a much more front facing option.
Thank you.
Right, Councillor Carpenter.
Yeah, I just think this is a really shrewd move to extend this service to keep people safe and looked after in their own homes. Has the feedback from people using the service been good? I would presume so.
It has. We've sent out over 1,000 surveys to individuals who've been in receipt of both home-based and bed-based. In general, the feedback has been positive that people's relatives haven't had to stay in hospital longer than they've needed to, and actually the person's been able to be assessed in their home environment rather than an environment that isn't, you know, their usual place of residence. But we are continuing with that feedback so that we can continue with co-production moving forward as well.
Right, Graham, are you going to cast a...
No, not at all. I just wanted to say that we had a detailed briefing of lead opposition members last week, and there were no comments other than broadly in support of this decision today.
Good, thank you. Well, thank you, Gail and Denise. I'm really happy to approve to modify the 4 contracts and to modify the 6 contracts to extend them to the 1st of October, from the 1st of October to the 31st of May. Okay, thank you both very much. And as I say, let's hope it carries on even longer. Thank you.
Thank you.
So if we go to agenda item 2, serious violence reduction grant.
Good afternoon, Councillor Fairhurst.
It's going to be you, Simon, is it?
It is indeed. So this is a non-key decision to approve a grant value of £38,000 for no limits to implement the 2nd phase of a service in the emergency department of Hampshire hospitals. This is part of the money we get from the Home Office to support violence reduction interventions. And it's about reachable, teachable moments for those attending the emergency department who may benefit from intervention to then reduce their risk of serious violence, thinking about mental health, substance use issues. We are doing some evaluation work because there's a similar programme in Southampton, and that will enable us to take that forward. And conversations with colleagues, particularly in children's, as this is the young people's programme, is to make sure we have a really holistic approach to that going forward, thinking about mental health, substance use, and the whole gambit of issues. So this isn't taken in isolation. Very happy to take any questions. That's a quick summary of where we've got to.
No, thank you, Simon. Councillor Withers.
Chair, well, obviously this is a very important grant funding, and you know, there's an increase obviously coming out from COVID of expectation that this will continue to be delivered, and we must support it 100%.
Absolutely, yeah. I mean, it's another one of these things. It's a no-brainer, really. If we can do it, we should be doing it. However, I'll carry on. Councillor Briggs.
No, I agree. It's sad that we need it, but it has to be continued. And I just hope these people are followed up afterwards.
Sorry? They're followed up? I think there has been some follow-up. If you, Simon, do you want to talk to that?
Yes, Councillor Briggs, there's definitely follow-up of the individuals to support them into the right kind of intervention. Obviously, it is our personal choice to enforce them, and I think kind of going forward, what we want to do is really embed this in the approach for the emergency department so it becomes sustainable rather than actually an add-on. So it's really about an intervention, but also equipping the emergency departments to support and ensure these people do get to the right intervention that they need.
Thank you, Simon.
Councillor Carpenter.
all I would add is it's a relatively small amount of money for a big impact. So I think I would fully support this recommendation.
Graham?
Yeah, I refer you to my comments of a few moments ago. So we had a full briefing of opposition lead members last week, and they were in support of this application.
Yes, I'd be very disappointed if they weren't, to be honest. So anyway, very happy to approve the grant. Thank you, Simon.
Many thanks.
Thanks. Right, gosh, we're getting through this quickly now, aren't we? Agenda item 3, demand management and preventative grant award. Peter, are you here?
Yes, I'm here, Councillor Fairhurst.
Yeah.
Thank you. So this item is to approve an award of the local solutions grant of 29,700 to Citizens Advice Winchester to cover an 18-month period between 1st of November 2021 and 30th of April 2023. This grant is part of our local solutions grant programme, which is part of our wider demand and prevention work within adults health and care. This is very much aimed at both local community-based solutions as well as more innovative ways of working. And as you'll be aware from previous papers, a grant is a sum of money which is towards the cost of it, and it can be considered a one-sided gift, but it's only part of the cost. We recognise that other parts of the cost will be made by other parties in terms of the other funding they get in, and it also represents good value. And this grant doesn't represent the full cost of the project. In terms of the scheme itself, this is to provide a service inside an integrated advice, a mental health service, integrated advice service within Melbury Lodge, both during discharge and post-discharge. This is very much aimed at supporting individuals in terms of their financial and life management skills, recognising that a lot of those issues relating to financial and life management can lead to that mental health into acute intervention, but also could lead to readmittance or to further services going forward if that isn't dealt with. This builds upon something which is already in existence or has already existed within Melbury Lodge and will benefit those patients within the Winchester and wider area, which has been delivered by community-based mental health staff. However, this will then extend that exchange into that community, as well as being delivered by Citizens Advice, who are trained, will have a trained individual, also supported by other trained volunteers, who are enabling this work to move forward, ensuring that these people have the right skills and also support both inside Melbury Lodge and in their community. As a programme, this is very much being developed with mental health operational teams and the commissioning structure, and recognises a need that they've identified and has been developed in partnership with them in the application coming together, rather than just as a separate application. It's very much part of that work. In doing so, it should have operational benefits, initially decreasing the operational staff resource within that centre providing that service, but also enable those staff to carry out other additional critical activities. In terms of our monitoring of this grant, one of those things will be to enable, as well as monitoring the outcomes from this grant, was also to see what we've identified certain metrics in terms of those sort of delivering savings to our service, and they will be also monitored as part of the outcome process. As a grant, this obviously fits within our budget envelope for the demand management prevention programme. And I'm happy to take any questions. Thank
you, Peter. Again, it's another one of these things that actually we should be doing it across the county, and hopefully if this trial, this project proves successful, we will be able to export it to other areas.
Yes.
Because anything that helps people carry on with a normal life, as opposed to getting into trouble, getting into problems again and coming back to the system, if we can prevent that, it's so much the better.
Very much so. That's very much the essence of this grant.
Yeah. Councillor Withers.
I fully support it, and I'm impressed basically by the jointry that is working with the organisations that all put in funding for this activity, because
Councillor Briggs, are you with us?
I am.
Have you got any questions?
Yes, fully support it. And as we keep on saying, prevention is always the best method. And if we can help these people to lead a more normal life afterwards, then all to the well and good.
Thank you. Councillor Carpenter.
Yeah, and I support it as well. I won't have nothing to add. Thank you.
Okay, thank you. Do we know what's so wrong with E2 Court that it's gone like this? No? Okay, well, we'll just keep going and hope we get through without it happening again. Very happy to give approval, Peter. And thank you very much, but don't go away because I know you're coming back for agenda item 4.
And I'm here already, as you may have guessed. This is a separate report, but it's to give permission to publish a grant scheme, be known as the Learning Disability Connector Grant, which will have a total value in its grant budget pot of 30,000. It also is to recommend that you as executive member delegate authority to the Director of Adult Health and Care in consultation with yourself following receipt of bids to award the grants from this grant programme. This grant programme is designed to support initiatives in terms of what's going on in Hampshire. We have a lot of services, both community based, which are there to support those with learning disabilities. However, sometimes there's the people's awareness of those services isn't there, or in terms of ones which will best meet their need. Or the other issue is that sometimes they know about some of the services, but not all of them, and that sometimes that doesn't always align with their interests. Yeah. The other part of the service is that sometimes people require support to access this service in terms of that warm handover, having someone they've met before who can then introduce them to that service to take away some of that apprehension about going to these new services. This connector grant is designed to kind of fill that spot in terms of to find out and speak to that individual beforehand, find out what their needs are as well as what their interests are, and then match them to local community services which can then deliver to meet their needs. As a scheme, it's we're looking to trial this in the Hart and Rushmore area. So the grant is for the Hart and Rushmore area only at this stage, and that has been developed via engagement with learning disability staff, both in operations and commissioning, who have recognised there's a specific need at the moment in this service. However, as we've discussed with other services, if it is successful, that can be spread to other areas, and if that is so, following that sort of outcome measurement and monitoring, that will come back to you, of course, for a further executive member decision report.
Super, thank you, Peter. Again, I can't see absolutely anything wrong with this. I'm well aware that some people with learning disabilities are sort of put into groups at a fairly young age to give their parents respite, but actually their interests and hobbies change, and if they don't know what's out there, that they might end up stuck somewhere where they'd actually rather not be, rather than doing something they enjoy. So, yeah, okay. Councillor Withers.
I fully support what you've just said, actually. It's very important, that the individuals know what services are available, and also that we get feedback on the trials for further learning when we expand the service to other areas.
Absolutely, thank you. Councillor Briggs.
Yes, fully support it. It is because people are individuals and they mustn't just get overlooked because of any disability. They must be encouraged to do things that they enjoy.
Thank you. Councillor Carpenter. Yeah, as co-chair of the Learning Disability Board, I expect you've got a great interest in this.
Yeah, I have, and I was going to say that actually I think it's something that the learning disability and maybe the autism partnership boards could broadcast is available, but also through that connector service as such, the boards could also be advertised to the users of the people who use that service. Is it going to be run by advocacy services? Is that the idea, or other organisations?
At the moment, this is for that. We're looking for permission to go out on that grant scheme. We don't know who the applicants of this programme will be, but once we do know who they are, we'll make sure we communicate it with you with yourselves, and especially also with the board as well, to make sure that we can get that awareness out there in the community. But at this stage, we're just looking to open up the grants programme itself.
Thank you, Peter. Very happy to approve the grant and to delegate authority to the Director of Adults Health and Care. Not that you've not got enough to do, Graham, but to award the grants. Thank you.
Thank you.
And thank you, Peter. Right, I think it's Stephen now for agenda item 5, sexual violence services. Welcome,
Hi.
Stephen.
Thank you very much. Thank you, Chair. Yes, as you say, this report is around the sexual violence and support services. The purpose of the decision we're looking for is to award 2 separate grants to support these services. So the report, as I say, it covers 2 different contracts, both of which contribute to the overall sexual violence services across Hampshire, Portsmouth and Southampton. The first one is the Rape and Sexual Assault Counselling Service, the RASAC as it's known, and the second is the Independent Sexual Violence Advocacy, or ISVA as that one is known. The current commissioning arrangements for these services across the patch are complex. The County Council currently commissions 4 RASAC services, which are jointly funded by CCGs and NHS England, as well as 1 ISVA service. The Office for Police and Crime Commissioner also commission services, as does Portsmouth and Southampton. So although the County Council currently holds the main ISVA contract, the County Council is a minor funding partner in the overarching responsibility for victim support does sit with the OPCC. Similarly, the County Council also has a historical lead on the commissioning and procurement of the RASAC services. Discussions across all partners, including Southampton, Portsmouth and the OPCC, resulted in an agreement to look to align these funding streams, with the OPCC taking on the lead for the commissioning of these services as a pan-Hampshire provision. The contribution from Hampshire County Council for the advocacy service, the ISVA, is proposed at £16,800 per annum, which over 7 years gives a total contribution of £117,600. This level of contribution doesn't represent an additional budget pressure and consistent with current planned and annual spend. And similarly for the counselling service, the RASAC, proposed spend from Hampshire County Council is £67,394 per annum, giving a 7-year total maximum up to £471,758. And again, that's in line with current planned budget provisions. There has been quite a bit of stakeholder engagement around this, both in terms of people who've used the service as well as professionals and those working alongside the service. And by and large, people are in favour of aligning and combining these services for more efficiency and particularly more clarity around how they're accessed and used. Therefore, the report is seeking permission to approve a grant up to £471,786 to the OPCC, up to a maximum of 7 years for the delivery of the Rape and Sexual Assault Counselling Service, and a second approval for a grant up to £117,600, again to the OPCC, again for a maximum of 7 years for the delivery of the Independent Sexual Violence and Advocacy Service.
Right, thank you, Stephen. Again, it makes perfect sense. And to have a unified service across the whole area under the OPCC makes sense. And as you say, we're not actually the major player in this anyway. So thank you. Councillor Withers.
Fully supported.
Thank you. Councillor Briggs.
Yes, obviously supported. Can I just ask one question, please?
Yeah.
I presume the counselling service includes young men, both sexes, in other words.
Yes, it's my understanding that it does. My colleague is also on the line, so if I'm wrong, she'll step over the top of me and correct it. But as far as I'm aware, it is of both genders. Yeah.
Yeah, because I know people focus on women, but it's just as traumatic for young boys, men.
If I can just add, it does include, yes, it does include men and women, but it also includes children and young people as well.
Thank you. Councillor Carpenter.
Yeah, I think I might have asked this question before. Apologies if I have, but I see that it's going to be run by the Independent Sexual Violence Advocacy ISVA service. Has that got anything to do with the organisation Victim Support? Because I know that organisation quite well through someone I know who works there.
So obviously where this is looking for this proposal for a grant, this grant will fund a new tender which will be developed. So it's we can't say at the moment who would run the service, but obviously across the sector these services obviously all talk to each other and refer in as and when required. So there will be sort of communication on the ground, but at the moment we couldn't say who will be running the service because that's subject to the outcome of the tender.
Okay, right. Stephen, thank you very much, and I'm more than happy to agree the recommendations. And again, I think you're staying on the line, aren't you, for the next one?
No, it's Jason Norham for the next item.
Jason, sorry, yes, I forgot. Sorry, Jason, are you here?
Yeah, good afternoon, Councillor Fairhurst.
Good afternoon. Right, this is for the appropriate adult service, yes?
That's correct, yes. Yeah. So seeking executive member approval for a grant, another grant to the IPCC, actually similar to Stephen's just laid out. So this is for a 5-year period for the appropriate adult service for Hampshire, and a total money of just over £386,000. So the the appropriate adult service is in place to ensure that children and vulnerable adults are treated fairly when they're being questioned by the police in custody suites. And their role is to help prevent the risk of miscarriages of justice and to ensure that evidence obtained is obtained safely. And they do that by making sure that people understand their rights, that the detained person understands the process that they're going through and the questions that are being asked of them, to observe whether the police are acting properly and to tell them if the appropriate adult thinks they're not, and to assist communication between the detained person and the police. It's a requirement for an appropriate adult to be in place whenever a vulnerable adult is being questioned, but there is no statutory provision for vulnerable adults. There's no one body has been identified as having to fund this in law. So rather, the Home Office has set out a range of partnership arrangements which they feel that local authorities and the local police and crime commissioners should enter into under an appropriate adult partnership agreement for England. So the arrangements can vary from area to area. Previous to this most recent contract, the County Council held the contract for this service, and we're now proposing that the Office for the Police and Crime Commissioner will manage the contract and the financial contributions from the various parties, which are ourselves, Southampton and the Isle of Wight. So the OPCC can ensure that consistency across those areas. And prior to this being delivered externally, the role of appropriate adult was often taken by qualified social workers employed by the County Council. So it's significant, administrative and management responsibility there. In terms of use, this is a very kind of this service is used a lot. So certainly in 2020, and there were just over 1,200 episodes or interventions by the appropriate adult services for vulnerable adults in Hampshire. So significant usage, and there have been 700 interventions in the first 6 months of 2021. So fairly consistent. We think of sort of around that sort of 1,200 to 1,400 interventions per year. In terms of finance, the financial commitment represents Hampshire Adults Health and Care contribution. Other partners will make their own contributions. The grant agreement would be issued to the OPCC. It's a cash limited sum, so it's been identified within the budget. It's not a budgetary pressure. This is a continuation of a service that's been in place since 2014. The grant agreement will place obligations on the OPCC in terms of reporting. And obviously, the County Council will be able to reclaim any sums that are not spent.
Yes. Thank you.
Yeah, that's about it in summary.
No, that's fine. Can I just ask, are children's services paying to the OPCC for the children's vulnerable appropriate adult service?
Yes, the children's are contributing separately, obviously, to adults for their service. Their service works a little bit differently in that the youth offending teams are very much tied into the delivery of that service and the oversight, so slightly different. Whereas we don't get as involved unless we get a referral through our front door, essentially, for individuals.
Okay. Right. So yeah. Okay. No, that's absolutely fine for me. Councillor Withers.
Taking the point the chair has just made about the children's services funding this themselves and dealing with individuals, taking into account quite a few medical or mental health issues go from the children's services to the adult services. Does that happen? And secondly, does the data concerning that individual, is that passed forward to the relevant department?
So data protection is quite complex. This was quite a complex data protection impact assessment. So particularly on the children's side, youth offending teams are notified when the police require an appropriate adult, and youth offending teams then have oversight on that individual case. For adults, we don't receive that data. We don't get involved in that flow, so the police would engage the provider directly if they need an appropriate adult for an adult.
Okay.
Okay, thank you. I fully support it, obviously.
Graham, you want to come in then?
Yeah, I think just to make a point really, in terms of an appropriate adult, whether it be a child or young person, or indeed a vulnerable adult, it's an of the moment issue, in that you need to have somebody available for police interview under PACE. Clearly, in terms of legislation, different legislation and therefore rules apply for children and young people, hence the involvement of the youth offending team. It's different and separate for vulnerable adults in the way that Jason has described. It isn't prescribed in law in terms of, strictly speaking, whose statutory responsibility is it, but there's a memorandum of good or best practice in terms of local authority and police and crime commissioners. But it is an of the moment issue, so that's why the data protection issues are particularly relevant. Clearly, subject to what happens following police interview, data sharing then will take on a different context depending on what happens next. But it's in that moment where the appropriate adult's required, which is absolutely key and crucial here.
Thank you.
Thank you.
Anne, sorry, Councillor Briggs.
Thank you. Obviously supported, but can you just tell me, I might have missed it, you use our social workers are the appropriate adult. Who are they?
So that was prior to 2014, it was social workers. Since 2014, it's been externally contracted to an organisation called the Appropriate Adult Service, and they are the biggest provider of appropriate adult services in England. So they're an independent company, essentially separate from the police, the IPCC, and ourselves. So they are a totally independent entity.
Thank you. I didn't know who the appropriate adult was. Thank you.
Councillor Carpenter.
I think Jason has answered my question. I was just interested to know how appropriate adults would be organised across the whole area of Hampshire, because it's such a huge area. But I presume if it's a company that does it all over the country, then they're going to have people all over. So that's answered. Thank you.
Okay. Right. Well, thank you, Jason. More than happy to approve the recommendation. Thank you. Thank you for your time. Right. Before we go on to our agenda item 7, Councillor Hiscock, would you like to speak now? I've still got Councillor Hiscock. Yes.
Yeah. Thank you, Chairman. I won't take very long. It's quite a short point I want to make. I know it's a long paper and you have a lot to talk about. I'd like to talk about the proposed changes to the budget relating to social inclusion. Situated in my division are the Winchester Churches Night Shelter, Trinity, Westview, Sussex Street, and the St George's Centre. I regard this for the most part as positive, as do most but not all of my residents, some but not all of the time. And we do have our issues, but sometimes. The people who work at these facilities do a wonderful job in providing homes and support and counselling for some of the most vulnerable and disruptive people in our community. For Trinity and the night shelter, the great majority of the funding is raised by generous supporters who admire the work that they do, and much of the day-to-day work is done by volunteers. I will focus on just one aspect of the proposed cuts today, though, and that is the specialist services funded by adult health and social care, particularly the community support for sufferers from drugs and alcohol misuse and poor mental and physical health. We all know the proportion of the clients who suffer from the effects of substance misuse and poor mental health. The consequences of further reducing the drug and alcohol service and the local support could very quickly become very obvious and very public. Clients who use these support services often live a chaotic lifestyle with very little awareness or interest in time or location. Many are unable to budget or plan their day effectively, so to think that they will be able to benefit from this vital support that is now provided locally, once it has moved to another part of Hampshire, and expect them to travel there and to arrive at the right time on the right day is an error. I'm sure that when you speak to the providers, they will tell you the same if they haven't already. I welcome the lines about the engagement and consultation on pages 207 and 208 of the report, but I hope that you are able to actually do what those who have consulted argue for, even if it means you may not be able to make all the proposed savings from this sector. Thank you, Chairman.
Thank you, Councillor Hiscock. Graham, are you presenting this? Or is Anne?
No, I'm happy to. So if I can respond perhaps in the first instance to Councillor Hiscox, and I know Simon is on the call or on the meeting as well, on the basis that we're talking about a complex set of factors here involving substance misuse as well as the provision of support around homelessness. So there is an issue of intersectionality in terms of a range of issues that come together here. So in the first instance, I think it's important to bear in mind that in terms of the proposals within the paper and around those social inclusion services, the proposal is to reduce by a sum of £360,000 the amount of non-statutory funding that we departmentally make into these services. There will still remain more than £2 million, which is available and going forward will support a range of social inclusion services. The second comment I would make is with regard to colleagues in district and borough councils as the housing authorities. And of course, we've seen in the last few years, new statutory duties come forward to housing authorities. So in a two-tier area such as Hampshire, that is the district and borough councils, which places additional statutory responsibilities around homelessness and support for those that are at risk of homelessness. And those new statutory duties have come with new burdens funding, so additional funding passing and flowing into district and borough councils. As Councillor Hiscox has said, we do intend, subject to decision today and indeed going forward in terms of Cabinet and Council, we would like to take forward stage 2 consultation. We have a track record in terms of work that we've previously undertaken in this same area around social inclusion. It's a non-statutory funded area for this department, adults, health and care. And we worked very diligently with borough and district council partners previously. And indeed, the Health and Adult Social Care Select Committee established a working group in order to work alongside officers across the county and district and borough councils, working out with voluntary and community sector partner organisations. So subject to decisions reached today, and as I say, going forward, I would hope that would be a process that we could follow in that same level of detail going forward with regard to these proposals today. Simon, I don't know if you wanted to come in and add anything in terms of the substance misuse elements, which are funded frequently through public health funding.
Many thanks, Graham. And Councillor Hiscock, as Graham said, there's lots of intersectionality here, which may cause a slight confusion and change. So with regard to the substance misuse service, that was subject to a stage 2 consultation over the summer, and that will come back to Councillor Fairhurst's decision day in November. We are looking at how we can work really closely with the venues in Winchester for, as you say, those vulnerable clients who are perhaps more chaotic than others, and we are making sure there's good service provision in Winchester for those clients going forward, and we will be giving more details following the consultation of how we are doing that at the decision day in November and at the scrutiny committee in October.
Thank you for that.
Okay, Councillor Hiscock, I look forward to seeing you at decision day in November.
I'll be there. Thank you, Chairman.
Thank you. Graham.
Yeah, thank you very much indeed. So beyond those specific elements from Councillor Hiscock, I wasn't planning to go into any particular detail, given that we spent about an hour or 20 minutes not that long ago at the Health and Adult Social Care Select Committee presenting and indeed responding to questions from members of the HASC. Anne Hibbert and myself are more than happy, and I'm sure Simon will as well, should there be any particular questions. But I would essentially want to say it's the report with its recommendations as presented to you today. Thank you.
Yes, and I tend to agree. Although I had to leave HASC early, I thought it was given a very thorough airing before I left. I don't think making savings is ever easy, but I always think that we actually approach it in the right way and often achieve very good outcomes from doing so, which is what I hope, again, will happen in this case. Councillor Withers.
Fully supported.
Right. Councillor Briggs.
Having been on the original working party, working group, I think we did our absolute best and have nothing more to add.
Thank you, Councillor Briggs. Councillor Carpenter.
I mean, I've got full confidence that you yourself, Councillor Fairhurst, and Graham and his team will rise to the challenges in this. They are considerable. And you never know, we may get some funding injected in from somewhere at some point as this goes.
We live in hope.
We live in hope, and I trust that we will continue as well to, lobby for the area, the area of adult social care and public health with the government. Thank you.
Thank you, Councillor Carpenter. We are trying. We will see what happens. Graham.
Yeah, thank you. And I was similarly accused of being overly optimistic this morning in making my presentation, but hope springs eternal. I just wanted to be clear for your decision day, Councillor Fairhurst, that in terms of the proposals put before the HASC this morning, they were approved by a majority, and there were no alternatives presented. So it's as written within the report. Thank you.
Thank you. Right, very happy to approve the submission of the proposed savings options for adults' health and care, and we'll present them to the Cabinet in due course. Okay, thank you all very much. Thank you.